Good afternoon. Seated on the dais are very dear friend and a very precious colleague, Padma Shri Dr. V. Mohan. I am doubly delighted this afternoon, but this program has been organized by him and also dedicated to a concept and the idea which was for the first time floated by him. And it gives me a special joy also to recall that there has been a very close professional as much as a personal association with Dr. V. Mohan and in fact the entire family. He was recalling the Chennai connection. We share a common alma mater in the form of Stanley Medical College. I know how many of you in this room are aware of the fact that his father, the legendary Dr. M. Vishwanath, is still remembered as one of the fathers of diabetology in India. He, along with Professor M.M.S. Ahuja, Professor Sam Moses, and some others, were the first to give the concept of diabetology as a separate area of study, research, and practice. And I think he was also among the first in Madras, which is now known as Chennai, to have started a nursing home, which was at that time known as the Vijay Nursing Home, and we were students. And incidentally, Dr. V. Mohan was my senior, and his younger brother Vijay was my junior. So, in the middle of the family, and I'm glad that this association has always consistently grown from one level to the other, both professionally as well as personally. We've also maintained, and thankfully, I'm thankful to God Almighty, we've been able to maintain contact with each other. And the very recently, just about 3-4 months back, the Lifetime Achievement Award, which was conferred on me very generously, very kindly, at an international conference in Chennai as a medical professional. The conference also was organized by Dr. V. Mohan. So I have to thank him for that as well. But that apart, Dr. V. Mohan is today known across the globe for many firsts to him. I think he was among the first who started an exclusive diabetes healthcare center and a healthcare facility. And that's how Madras gradually came to be known as the diabetes capital of India, not because of its higher prevalence, but also because of the higher standards of diabetes research and a pioneer in doing so. And he was also among the first to have raised the V. Mohan Center, the Madras Diabetes Center, to international levels. It's now a center which is often referred to, quoted to, in any conference of repute across the world. He was also the first to have been globally hailed for having produced maximum number of diabetes-related published papers from a single institute year after year for several years. And I think if the cameramen are blocking me, the others can clap for him. And he's also the first time, I think, a full-time diabetes expert, researcher, and scientist who was recognized by the government of India with a Padma Shri. So there's been series of countless national and international recognitions and awards which Dr. V. Mohan has been conferred, but he has carried on with a single pursuit unidirectionally, and that is something that each one of us should be learning from him. Now, seated with him in Dr. S.V. Madhu, I don't know how many decades we have known each other. Dr. V. Mohan was referring to that conference where I was the scientific chairman, the RSSDI conference in Delhi. And incidentally, Dr. Madhu was the organizing chairman. So I think my task was made much, much easier because the local organizing chairman happened to be Dr. Madhu. And therefore, the scientific program could also be devised the manner it was done. Ever since then, we have been in touch with each other, especially after I moved over to Delhi about 10 years back. And the ironic part of the lighter vein is that for the last 2 months, Dr. Madhu has been calling me up almost every Thursday and telling me that we have to sit together because we have prepared some guidelines which we wish to discuss with the health minister. So I always send back the message, say, shall get back. So, every third morning he writes a WhatsApp, he says, are we meeting? And I say, shall get back. So now I was telling him when I met him downstairs, I said maybe destiny wanted that we should go all the way to Jammu to fix up a meeting with each other. But I'm glad that it's all been very close associates in the fraternity as well as personally. Dr. Ashutosh has made a name for himself as a professional oncologist and a very successful principal. And I appreciate all the support that he gave to this study because it wouldn't have been easily possible but for the administrative support and the academic support from the medical college management. Dr. Tarveer Kaur from ICMR has very consistently stood by all of us. As she said, there were several DGs. Dr. Behal is there, earlier Dr. Bhargav was there, Somya was there, so many of them. But Tanveer always continued to be there. And about Rajiv, the lesser said the good. I think he's done such a tremendous job. We all owe to thank him. This is one of the important landmark studies. In fact, it so happened that I think around 2010 or 2011, when Professor V. Mohan floated this idea of having a study of this magnitude involving ICMR, and it was very appropriately named India Diabetes Study. And he wanted me to be the principal investigator for North India, including the states of Punjab, Himachal Pradesh, Haryana, and of course Jammu and Kashmir. Maybe, as I said, he didn't know that I would suddenly switch over the roles. But when it did happen, then I conveyed to him, I said, it may not be possible for me to do justice. So we had a junior colleague of ours who's now, of course, incidentally become a director in Sher Kashmir Institute, Ashraf Ganai. So he had been associated with me in a number of research projects. So I said, since he is from endocrinology, he can come handy. But then the problem was that his reach was limited to the valley and he couldn't have accessed this part of the country. And therefore, our natural choice was somebody who was an expert in community medicine. And last time I saw him, he was younger. But today he's grown younger still and he's become head. Last year, you awarded me at NAMS Medical College. I was conferred. That's right. Oh, in Ramaiya, yeah. There was a convocation in Ramaiya. That's true. And but I can just say in single sentence that Rajiv has done a better job than I could have done. Now, before I speak a word about the study per se, see what is typically happened in India today, whether we realize or not, and maybe now it's no longer the concern of medical fraternity alone. On the one hand, there's a changing disease spectrum. Till about 80s, we were mostly confined with communicable diseases. Most of the mortality also happened with tuberculosis and all the other cholera, etc., etc. But then with the advent of antimicrobials, etc., maybe somewhere in the late 80s and so, this new phase of non-communicable disease, which of course includes type 2 diabetes mellitus, coronary vascular disease, etc., set in. And somebody wrote a humor piece that India now has stepped into an era of civilized diseases because these are known as the disease of the West at that time. But unfortunately, what has happened is that though we had stepped into an era of non-communicable diseases, the communicable diseases also did not give up chasing us. So now we have a biphasic disease spectrum. And so also in the Western world, because in the West, they had almost become oblivious of problems like tuberculosis, etc. In fact, for many years, we used to get interns from UK for a stint in AIMS, Delhi, to be posted in the tropical disease wards because they didn't have that. But after the AIDS came in, then they also had an upsurge. So on the one hand, now we have a biphasing, so we are confronted with a very large spectrum. And COVID, of course, heightened this. On the other hand, we have an increased lifespan. At the time of independence, we were just about 55 years, 50 years. Now it's gone up to 66 years, still rising high. And it's always very fanciful, always a fashion to say India is a young country, which is, of course, rightly so, because 70% of our population is below the age of 40. But I always tell, whenever I'm among the students and medicos, that this is only half the truth of the story. By percentage, we may be more than 70% below the age of 40. But at the same time, the absolute number of plus 60 is also on the increase, which means that the younger population has grown in percentage, but olders and the oldies are not ready to quit the planet. So they are also stable. So again, now we have a biphasic lifespan, which is, this is an expression which I think is appropriate to be used, though it's not in the textbooks. So we have to, upon that, the other issue now, complicating that is, that while people are living long enough to get diseases which they otherwise would not have got because they didn't live up to that age, which includes many of the malignancies. But at the same time, the diseases of the later age have started happening at the younger age. And there comes in type 2 diabetes mellitus. For example, if the type 2 diabetes mellitus was heard of by any clinician about 3-4 decades back, he would think of he would visualize an individual in his 40s or maximum 40s or maybe in 50s. Now it's happening in the second decade, third decade. And it was a norm. If you came across a newly detected diabetes, maybe in his 20s, you would immediately put him on insulin, assuming that it was insulin dependent at type 1. But it's no longer so. Because in the earlier stages in 1990s, we started faltering. Some of the patients started going into hypoglycemia because we would put them on this assumption. Then we realized that they could be cured by metformin. So now that is another issue. And the fourth one, which was highlighted in the study also, is obesity, and more so the central obesity. I was very closely watching the findings. Even in Jammu, he has shown 62-63% of central obesity. Now, all of us know that central obesity per se is a risk factor for type 2 diabetes mellitus, also all the other metabolic disorders, regardless of the overall obesity. And in fact, we did a study in late 90s with Dr. Pune, Dr. Yagnik. We scanned a set of individuals of European origin and Indian. We found all the Europeans looked bulky, hefty, but their visceral fat was very little. Whereas Indians looked lean and thin, but the fat inside the CAT scan was much higher. And incidentally, the dress culture over here is that you can wear a kurta, you can hide it. You can wear a 6-meter sari, you can hide it. So that is an issue which is not being sufficiently recognized in the Indian context, and I am amazed today. We did a study on central obesity in somewhere around 2003 or 4, and we found that it was around 65-66%, or almost equal in males and females. Here also, it's almost equal in males and females in the presentation made by Rajiv. It's around 62-63%. So that is something which is alarming, because that could be the mother of the other diseases as well. The other part is, because if we realize the genesis, then we would know how to go about preventing it. And we did a paper in JAPI some years back. There is a breakdown in the rural-urban divide and a breakdown in the region divide. When I say region divide, for example, earlier on, type 2 diabetes mellitus was known to be the disease of the South India. That is why the first diabetes center came up in South India. The first center of diabetology in Madras Medical College, with Dr. Seshi as the first head, also began there. It was not that much prevalent over here. And the Kashmiri migrants study, which Dr. V. Mohan was referring to, has a number of case studies where we came across Kashmiri patients who had never heard of diabetes. There's a very interesting case study of a very senior bureaucrat who started feeling suddenly very thirsty. So he told his attendant, don't waste your time, don't waste my time. Each time you find my glass empty, fill it with water. And then when he was detected, he said, oh, we never heard about it in Kashmir Valley. And then we tried to dig out from the health department, the official prevalence spectrum of Kashmir Valley, and the most common disease at that time were acid peptic disease, hypertension, and bronchitis related because of the heavy prevalence of smoking. People there had not even heard of type 2 diabetes. Now it's equally prevalent. Whether it's north, whether it's south, and you see today, in today's study, I don't know how many of you have noticed, the prevalence of type 2 diabetes mellitus in this presentation in Jammu is higher than the national prevalence. That is something you have to feel alarmed about. It's 25% and it's 14%. So which is 18, 18, overall 18. Where is the overall 16 nationally? That's precisely what I'm saying. So there is a breakdown now within the regions. No longer it is confined to south. Rather, I was one day I was delivering a talk somewhere. I said now it's a democratization of the type 2 diabetes mellitus. You have equally prevalent. Nobody is being spared, and nobody can say, "Look here, I don't have type 2 diabetes mellitus," because we've seen those days when the sugar-free tablets started appearing newly in the market. It was a fashion to carry it in the lady purse, and whenever the tea was served, they would very fondly take out the and then tell everybody, "Have you not stopped sugar? We've stopped." So I think now that is precisely what has happened. And of course, the breakdown in the rural-urban divide was a paper we did in Japi. That was also about 10, 15 years back. And that's again because the lifestyle is now the same. The physical activity is same because even in the rural areas you have use of automobiles. And most of the food products are now being carried from the urban areas into the rural. They are no longer growing their organic food. And therefore, this now also becomes a matter of concern for Jammu and Kashmir. Whereas overall in India, you have 1.1 crore type 2 diabetes mellitus and 1.36 pre-diabetes. Now, the significance here is that even before the symptoms appear or an overt diabetes is detected, you could have affected your organs. You could suffer from a myocardial infarction, you could suffer from an early nephropathy, and then only get to know that you actually were a pre-diabetes or diabetes. So it's become equally important to detect it at this stage. Also because, and I think that's again something alarming, overall in the country, 70% of mortality today is because of the non-communicable disease. And many of that mortality is contributed by the symptomless factors, symptomless conditions like pre-diabetes. And therefore, and yes, of course, we also once did a small survey where we noticed that every third patient visiting the OPD for any disease, he might go there for an ENT issue, or he may even go there for a gynae check, is found to be, when you go through a screening, is found to be having diabetes or pre-diabetes. So that is why it's virtually become an epidemic. And therefore, I always say now it's no longer an issue concerned only with the medical professionals. And I say diabetes is too longer, too serious a problem, which has actually become too serious an issue to be left to a diabetologist alone. It's virtually become a national concern. Also because nowadays we are talking of Viksit Bharat. We are talking of 2047 Bharat. And who are going to be the architects of this 2047? Those who are in the third and fourth decade of their life. So can we afford to let their potentials, their energy be wasted in these silent conditions and drain them out through their target organ damage? So it's become a national responsibility to preserve their potential, to preserve their energy for a better cause. The other part is diabetes in pregnancy, which of course also Dr. V. Mohan referred, because unless we are able to control during pregnancy, the gestational part, we will not be able to break this chain happening from generation to generation. And now one of the groups which is involved me also, we have started a multi-centric study, primordial intervention, though it's not easy. We've chosen Maulana Azad, we've chosen centers from Madras, of course. So that the fetus grows in a milieu with the same physiological environment as or that of a non-diabetic woman or a mother. That's not easy to achieve, but if unless we achieve that, we will continue to pass on the preponderance to the next generation. And therefore, to some part, I think at the level of government, what we are doing, because now I have to also talk partly as a minister, if you allow. Of course, the ICMR has taken up this cause in a big way, which of course again is a government administered agency. Prime Minister Modi was the first to realize the virtues of having non-allopathic means of prevention and cure. He was the first, soon after the government came in 2014, in the month of May. Within 6 months, he proposed in the United Nations that we should have an International Yoga Day, and the United Nations accepted it unanimously to have it on the 21st of June. And we have authentic studies to prove that there is a set of yoga asanas, Mayur Asana, Bhujangasana, Paschimottanasana, Ardha Matsyendrasana, which when practiced regularly might reduce the dose of anti-diabetics, might even reduce the requirement of insulin. Then also the holistic approach. Even when insulin was not discovered in 1921, I've come across some earlier physicians' books, handbooks, they're very interesting. They used to advise methi, this fiber, because they didn't have any medicine. So the merits of those, and this was realized by the government when Prime Minister Modi, for the first time, created a separate ministry for Ayush. So what I'm trying to say is the government is now equally supportive of our efforts. There is a proposal to have a dialysis facility in every district hospital. Ayushman Bharat is one of the, I think, best ever health insurance schemes in the world, because most of the health insurance schemes do not insure a person for a disease which is already existing. So, the only insurance scheme which exists, which insures you for a pre-existing disease. You detect a malignancy today, and tomorrow you can get insured and get the full refund for that. At the same time, as a as a means of, in an attempt to offer affordable, accessible healthcare, this government has been consistently coming out with one or the other decision. For example, we reduce the cost of these stents, and in biomanufacturing, we have now given a special impetus. Our institute in Trivandrum, the Chitra Institute, has now come out very well. We are among the most cost-effective manufacturers of medical instruments. And in biomanufacturing, we are now being rated, I think, number 13 in the world, and that's number 3 or 4 in the India Pacific. And therefore, India is now gradually becoming a more cost-effective, relatively cost-effective super specialty healthcare destination. Very recently, we have come out with a bioeconomy policy, considering that the next industrial revolution is going to be bioeconomy driven. So, bio E3, that means biotechnology for environment, because of the recycling thing, biotechnology for employment, and biotechnology for economy. And of course, this is Dr. V. Mohan was referring to Chandrayaan, so this is not the subject related to that. But one thing I find relevant as an excuse to use that is Chandrayaan raised the esteem of our caliber and our potentials. And and as students of science, if we have been taught not to speak without evidence, I'll tell you how. The ISRO, the Indian Science Research Organization, was founded in 1969. Now, that was precisely the year when Americans landed first human being on the surface of moon, called Neil Armstrong. He made that famous statement, small step for man, giant step for mankind. And we were just being born. Today, we have reached the southern pole of moon before they. So that has suddenly raised the esteem of the Indian scientific talent, that not only domestically, even abroad. And this also has happened in the last 10 years. I mean, prior to 2014, if an Indian youth went abroad, he felt shy of introducing himself. Today, if he introduces himself as an Indian, his job prospects certainly go up. So I think this is one of the best times happening to carry forward this initiative, which has been undertaken by Professor Mohan and the team. And we shall soon also involve the Jammu and Kashmir, because all said and done, we can't be leaving the state government machinery as well. There's a new government in place very soon. We are going to have a meeting with the chief minister, and I'm sure we will also flag out this issue, because this is something which might not have occurred to many of us, that our overall prevalence is slightly higher than the national average, which was not expected, because this is one of the northernmost territories of the country. and for a disease which was earlier known to be a disease of South India. But at the same time, I also wish to hasten to add that all this or everything can't be left to government alone. And all those countries who actually made a headway and succeeded reaching somewhere, they have done so because they did not depend wholly on government. And space sector itself is one of the best examples. We would always compare ourselves to NASA, but we never realize that NASA has almost 70-80% of resource for the non-government sector. So realizing that, we opened up about 4 years back, and now our space startups are the world class. So why I'm saying so is we would also put it across to the state government here. We have taken it up in a big way at the central government. A huge push to the private public participation. I think that could come in something like government medical college. We should not be hesitant in involving the private sector. At the same time, private sector should also follow some of our priorities. For example, if they are opening up a new corporate, they can open up a small ancillary branch in the rural area. So that is how it would work. Because if earlier on, and this government is quite open, thanks to private sector, because earlier on there was a lot of skepticism between the private and the public. The public sector always thought of the private sector as black marketeers, policers. The private sector thought of public officials as bribe takers, as scammers. So there was so much of skepticism. So I was the other day addressing a student. I said, when you board a bus, because now there are better means of travel, but in our times it's mainly the bus. तो उस बस में महात्मा भी बैठता है, गुड्डा भी बैठता है, चोर भी बैठता है, डाकू भी बैठता है. So you have sadhu sitting there, you have shaitan sitting there, you have sinner sitting there, you have virtuous sitting there. But suddenly when the bus breaks down, the tire gets punctured, which used to happen very often in my and your time. Then what does happen? Everybody gets down and starts pushing the bus. They forget. They forget who is each other's vices because the destination is common. The objective is common. So if we have to achieve this objective, achieve this effectively, we have to give up these barriers of the public-private. And why I'm saying so is that we have walked the talk. Just about 3 months back, we came out with the National Research Foundation through the Ministry of Science and Technology. Also, we are the first among the world, among the first. Only America had one, that is called National Research Society. Germany has one. We have come out with a better version. And very consciously, not only 70% of the resources from the private sector, we have also given representation not only exclusively to the scientific fraternity, but also to humanities, to also to social groups, to also human resource development, who can give a flavor of our culture, our context, while planning our scientific programs, who could also design our project structure befitting the requirements across the world, and also could advise on what kind of collaboration do we have. Because if we are thinking of Viksit Bharat, easily said than done, then we have to live up to global challenges. We have to have global parameters. We have to have global strategies. And there also we have started making headway. We were in Global Innovation Index, we were just 81 10 years back. Now we've jumped 41 places. We are, and startup ecosystem, we were nowhere. Today we are ranked 3 in the world. So that means we have the capacity of doing so. There was possibly not enough of support from the levels of the policy makers or the government, which is now happening. And therefore, from the point of Jammu and Kashmir, I think this is also one of the better times happening, because I can foresee that J&K hereafter is going to contribute to the overall growth story of India. And as I said, I'm not saying that without evidence. The point is, when we talk of rising to that pedestal 2047, most of us talk like politicians, most of us talk like public speakers. But when we talk of it as scientists, how do you rationalize it? From fragile 5, we are now top 5. 10 years back, we were fragile 5 economies, and it was said that any time they will be going haywire. But in COVID, we did better than many of the other economies with just having 500,000 population. And therefore, we proved it. But now, how do we reach that 2047 pedestal? Now we will have to explore all those resources which have remained either underexplored or unexplored. And those resources will come from regions like Jammu and Kashmir. To my mind, we have two main vast resources which have remained unexplored by the earlier governments. One is the marine resource. We have 7,500 long kilometer coastal area beginning from Odisha, Bengal here up to Maharashtra, Gujarat. And it's a huge wealth of metals, minerals, biodiversity. Otherwise, the other day I was telling a civil servant, I said, very soon you'll have to have a secretary for illegal mining in the seabed. And we have started that deep sea mission. Prime Minister spoke about it for the ramparts of Red Fort. So people have not yet realized it because when the results start coming. So the value addition to our economy is going to be there. Because all other sources, IT, etc., exhausted. Other is going to be our Himalayan sources. And those states, territories will lie in the bed of Himalaya. With Jammu Kashmir, Himachal Pradesh, Uttarakhand, Arunachal Pradesh. Already we've started Aroma mission, started from Jammu and Kashmir. A new genre of agri startups in the form of lavender cultivators has emerged. It's become popular all over the world. Prime Minister spoke about it in Man Ki Baat also. And therefore, I think the findings of the ICMR-India Diabetes, I'm sure media will be kind enough to give it due coverage. And I would also request, and we will also do it, we'll prepare small clippings for social media. Because we have seen that even many of the scientific work doesn't find enough slot in the media, but the technology is so strong that we don't need it. We conducted a longest ever coastal cleaning campaign in 2023, 22 in the world. And we had our own studio set up and our own clippings because people are watching just 2 minutes video or 30-second reel, which you can produce better. And the access is through that. So we can generate awareness. We can generate awareness through infographics, through information dissemination. Also, these are some of the lesser known facts. And of course, with the kind of access and influence that Dr. V. Mohan has across the society, that could be an asset to all of us. And I think I only hope is that we are able to pick up the right kind of cues from the presentation made by Rajiv, also take the right kind of measures and succeed putting Jammu and Kashmir in the main course of the mainstream journey of India, both in healthcare as well as in adding to the economy. And the two are very closely interlinked. And that's why I said it's not only a concern of those few in this room, it's a wider concern. And I'm sure each citizen will be able to contribute. That's exactly what is being envisaged when we talk of the Gold India 2047. Thank you very much for the patience.